53 degrees in Vancouver, 45 in Hillsborough.
It's 6:19. The older you get, the greater your chances for hip pain. About 1 in 4 people will have some form of it in their lives, and being young is no guarantee you won't get hip pain. But there are ways to treat it, even eliminate the pain.
Joining us now is Dr. Christopher Hykes, an orthopedic surgeon who's with Providence Orthopedic Institute. Good morning, Dr. Hykes.
Good morning, Steve and Rebecca.
So what are the most common causes of hip pain?
Well, the most common form of hip pain that I see as a total joint surgeon is wear and tear arthritis or osteoarthritis, particularly with the Asian baby boomers out there. And this usually presents with growing pain and some stiffness initially.
Now, we understand that you don't necessarily have to be way up there in years to get hip pain, that younger people are getting it too.
Oh, absolutely. There's the common sprains which resolve fairly quickly, but a lot of younger people have anatomic abnormalities in the hip joint, which can cause wear and tear, rubbing of the bones, and this leads eventually to osteoarthritis. A lot of my older patients had these problems early in life and were not really symptomatic, but as time goes on, it catches up with them.
I think if we thought about hip pain, we probably automatically think, oh, surgery, here we go. But what about physical therapy or medicine? Can you treat hip pain that way?
Yeah, a lot of times if you modify your activities and avoid impact type of, like running and change to more cyclical things like cycling or even elliptical trainers, swimming, that'll help improve the range of motion and help preserve the joint for a period of time.
Got to tell you, we do love getting free advice from a doctor because it's not easy to do these days. So with that in mind, what's your best advice for people to make sure that their hip is going to stay as good as it can be for as long as can be?
Well, first you need to pick the right parents. I mean, oftentimes it's a familial thing. My parents both had hip joints and knee joints, and I've already have 2 knee joints myself at this point. But short of being able to pick your parents, if you just maintain your weight and a reasonable physical activity level, that can help. And when you start to have symptoms, oftentimes mild anti-inflammatories, some over-the-counter types of things, and or physical therapy can be of some benefit to extend the life of that joint.
Dr. Hykes, thanks for your time this morning.
You're welcome.
Dr. Christopher Hykes, an orthopedic surgeon affiliated with Providence Orthopedic Institute.
All right, here's what's coming up on Portland's Morning.